first realised I had problems with my hands way back in 2014. Way back then, the symptoms were quite mild, but I was diagnosed with bilateral carpal tunnel. The discomfort I was feeling was basically just numbness and the constant tingling and pins and needles that generally started off as soon as I went to bed, but it actually started to interfere with my daily living during the day as well. Very much as soon as I get into the car, that was when it started.
I realised there was something wrong with my hands about 2 years ago. Sort of funny sensations, numbness, but it's the tingling and it's the pins and needles. And then the pain, really. They're always painful. The hands are always painful.
I would say I started looking at treatment a way back, sort of 2022, when this hand was still kind of mild. The overall procedure that I had was very easy. It was very precise, a very skilled surgeon carried it out.
When I had the consultation about 4 months ago, I was told that it was carpal tunnel for the pins and needles, and that it is better to have them done because if the longer you leave them, you lose your sensation. So I was offered a new treatment, which was a keyhole surgery.
Before Sono surgery, my patients who come through for carpal tunnel and trigger finger surgery would have an open approach. I'd still be doing it under local anesthetic, but it would mean an open incision in their wrist or in their palm, which would at least take 2 to 3 weeks for the wound to heal up, and maybe 4 weeks before they could start using their hand. I came across Spirecut and Sono surgery in my pursuit of wanting to move these procedures out of the main theatres. Rather than opening a big set of instruments to do an operation lasting 10-15 minutes, having just 2 small instruments to perform a minimally invasive approach was actually a no-brainer for me.
The actual procedure was over in a very short time, and I felt nothing at all.
You know, I still can't believe how quick my hand came back to feeling normal again. I was actually quite emotional that night. I had the procedure on the Friday and I was back to work on the Monday full time.
What stood out in Sono surgery is how remarkably safe and how effective. The results that I've had with my patients have been phenomenally good. Patients have started using their hand the day after the operation. I remember clearly a lady wanting to go back to looking after her lambs as a farmer the next day, and she was very happy with the results. It's just one example of many.
I would say to others, the fact that I've had a very successful journey so far to look at this particular surgery, which is the ultrasound guided surgery for carpal tunnel.
The recovery after the operation was very quick. Very little pain, and there was nothing to see at all, and I was using my hands the next day.
Would I have this particular surgery again for the left side? Absolutely.